So the museum has actually got quite a long history. It was opened in 1975 at the Stanley Royd Hospital, and it sort of represents the evolution of mental health care from the early treatments to the present day. And it was a bit of an extraordinary situation, really, because a lot of the collections like this have been lost. But at the museum, there was an interested, one of the secretaries to the museum was really interested in collecting the heritage, and he actually managed to save a lot of artifacts from destruction. So thankfully, we've got them here in the museum and in our stores today. And they're from the West Riding Asylum body as a whole. So they represent the collections from the hospitals in Wakefield, Menston, that's Hyroyd, Sheffield and Huddersfield as well. And this is just part of the collection, some uniforms that we've got in our displays today. So it's an evolving collection, and we like to think about that as a continually developing space. So some of the objects tell us more about the history of the 19th century asylum. We've been doing a lot of work in stores, as you can imagine, because we've not been open to the public. So we've been working through some of our fantastic collections. And as a musician, I was really interested in this one, that the picture on the left is some music scores we found that were associated with the church, the Asylum Church of St. Faith's. So we look after all that sort of thing. But we also collect more recent objects. For example, this running shoe was donated by one of the users of our services, and that entered the collection at 2002. So we're talking about how that was part of our Wellbeing exhibition. And central to all of how we approach our collections is the stories of the people. And we're trying to recover as many of these stories from the past as possible. And we also work to co-produce these with people, our visitors, people involved in the projects that we hold, people that live and work at Fieldhead. They are central to creating the stories in the museum. So what is the space for? Well, as I've said, it was really extraordinary that these objects survived. So actually, it's really important to protect them and display them, because this is quite an extraordinary story. So our job is to make sure that they're looked after carefully, they're curated properly, and as many of these objects go on display for as many people as possible. But we also use our collections and through our co-production look at ways of using them to promote well-being amongst people, to empower individuals to tell their own stories, to recover some of those stories from the past, and to really use the collection to start conversations. We like people to explore ideas around treatment and around mental health, to actually start to break down some of those prejudices and the boundaries to people's understanding about what experiencing mental ill health could be like. And importantly, for artists like yourselves, we like to inspire new creative responses. So as part of the museum experience, you will often see when you visit, there are lots of displays of artwork on the walls that have responded to our collections and the themes that we talk about. So part of our collection is patient artwork. The asylum, and we'll talk a lot about this on the course, had a long history of encouraging people to continue to explore and develop either their trades or their creative skills. So when they were in the hospital, patients would be involved in developing the trades that they were involved with before they arrived at the hospital. And they were also encouraged to do creative activities. And this is one which I must have walked past this several times, and I didn't when I was visiting the museum and before I worked there, and I didn't actually realise that it was created by a James Walker, who was a patient at the asylum between 1861 and 1863, and the photograph on the screen doesn't really do it justice because it's an incredibly beautiful bird's eye view of the asylum that the medical director had commissioned. So when you're able to come into the museum, it's really nice to have a real close-up look at this. So whereas we don't have an extensive fine art collection, we have lots of decorative art and the craft that people produce. So we've got things like samplers, lacework, carvings, and some drawings as well. And included in that, of course, in our contemporary collection is all the work that's been created responding to the conversations that we've opened today by contemporary artists. So when we're talking about our patient collection, we think about it in different ways, and we sort of devised this, and a lot of the participants on the last course were really helpful in helping us move our conversations forward about our artwork. And so we thought about it in terms of how did the experience of living in an institution affect ideas around identity? How did that come out in the artworks that we've collected today? And then how was art used as a vehicle for the voice and protest? How did it become a mode of expression for people who were quite often silenced? How did the gendered activities at the asylum encourage or discourage personal expression? And what other activities encouraged individuals to find their voice? So these are just some, and by no means all, the ways that we have started to look at and interrogate some of the artworks that we've got in the collection and other artifacts that we've got. And when we look at these themes, for example, control, we've explored this in terms of how, for example, many of the objects from the institution were stamped with the identity, so people became part of that institution. And we've explored this with our visitors and with people that have participated in our projects. And one of the really interesting things you'll find when you come to the museum is that we try and encourage all those perspectives on things to be on display and revealed. So this just shows you actually how different the opinions are about objects can be. So this is the picture in the middle is a spoon and a fork from the collection, and you can see the WRA, which is West Riding Asylum, and then we've got some pottery shards at the bottom that are also stamped with the insignia of the asylum. And so here we've got someone saying, "It makes me sad to think of people in these spaces. It's like they were branded as lunatics and everything they were surrounded with was stamped with their incarceration." But on the other perspective, we've got, "I miss the dining hall. We all ate together at the same time and it was a community. I was proud to work there and this reminds me of those times." So all the objects, the biography of them, and the different opinions that we get about them speak volumes about the different attitudes, perhaps prejudices, perhaps biases that we have as part of our collection. So it's really important that we take on board all these considerations and try and present them as equally as possible. That statement on the left reminds like lunatic in the museum with the knowledge that they are very much part of their time, and we talk about labelling a lot in the museum as well. So protest, thinking about the second theme of protest, if you are from Wakefield, you might be familiar with these samplers that we have in the museum. They're probably one of the most talked about set of objects we have. They were created by Mary Frances Heaton, who was a patient in the 1800s, and she conveyed her frustration with her time in the asylum by sewing these incredibly detailed and beautiful samplers, a couple of which are on display here, and we've got more in the museum. So when we talk about patient voice, we have actually got an area dedicated to this, which we are growing, in part in response to the participants from the last collection and a lot of the incredibly stimulating discussions we had around that. This is one area where we're actually able to see extraordinarily some of the patient voice actually preserved. And of course, because Mary chose to put her words onto something of permanence, they have remained. Unfortunately, a lot of those stories, as I said before, have been lost. And when we were talking last time, we talked about different ways that people have around the world embroidered or graffitied their clothing to express their story about time in an asylum. So that was a very interesting way of looking at those stories and how they might have been preserved. Wellbeing. As I was saying, Wakefield was sort of involved in encouraging people to carry on their trades and the pastimes that they'd had outside the asylum. So this is really beautiful examples of some of the carving that we've got. We've got the lectern on the left there, and also a mirror, which is really an expressive piece of work, and it's quite delicate actually, but we're hoping to get it mounted in the next few weeks if we can. So hopefully, fingers crossed, when you're able to come to the museum, it should be up on display. And we think that they were both created by the same people. So if you look on that old bird's eye view of the asylum, you can see the different workshops that they had. There was an area where brewing was undertaken, engineering projects, woodworking, and lots of gardening and allotments on the site. So these are some of the examples of how creative work has come out of the projects, which were examples of occupational therapy, really, some of the first examples of that in the country. So, and then interestingly, you've got more of the perspective from the females that were in the institution. And so they tended to get involved in occupations that were considered suitable for women at that time. So you would have many of the women working in the laundry or on cleaning duties, but they were also encouraged to get involved in what sort of corresponded to ideas of ideal femininity. So things like needlework and lace making. So we've got several examples of lace in our collection, and the little image on the top there is actually a paper cut, which is really small. It's only the size of a postcard, but it's very, very intricate. So there are a few examples of those in the collection as well. And the picture on the right shows us how some of this craft work was used within the collection. This is one of the lounge areas in the asylum. So they were certainly incredibly productive. I've seen lots of pictures of the interior from the Victorian period, and there's lots of lace on display and some of the macrame as well. So expression, this is an extraordinary document we've got here, and we had a good look at this on the last course as well. It's a sort of stream of consciousness work, which is incredibly poetic, but also, if you interrogate it, has lots of kind of commentary about life at the time, both inside and outside the asylum. So we talked a lot about other ways in which people who were living there were able to explore their creativity, either through music or drama, writing such as this. Some of those practices were formalised and they were part of, for example, annual Christmas shows. And some of them were informal, like this book. It was a personal act of self-expression. So I think we're really interested in trying to find out how people were independently creative, as well as those activities that were actually structured within the asylum, within their work programs, and how much agency they had over things they created. So this is just a little look round the museum. It's so difficult to capture, isn't it, on photographs and the sort of idea of scale and everything. But we have different areas, one looking at the sort of history and story of the early years of the asylum, then looking at different treatments and the fact that Wakefield was involved in some quite groundbreaking areas of neurology. Then we look at present day well-being. We look at ideas around control and restraint. The area that you can see in the middle photograph directly opposite you is our new patient voice area. And then we also have a temporary exhibition area, which we hope will be a place where we'll get lots of people's work from this project on display. This artwork here is one of the artworks we have on show in the museum, which is a direct response to some of our collections. So as Kate was saying, we'll explore this exciting journey over 10 weeks. We've got various ideas, and obviously some of this will have the caveat that it depends on the kind of COVID restrictions we are experiencing at the time. But we're hoping to do a museum tour and also visit the West Yorkshire Archives we have some documents in our collection, but they have also got a really rich collection of case notes, including photographs of people in the asylum, and we would love to be able to take participants there as well to explore those and get an understanding of that collection and how it's used. Then we would do some object handling workshops, just having a really close-up and hands-on experience of those objects we've been talking about, looking at some of our documents that we have in our plan chests, like playbills and some of the records associated with people entering the asylum. Then we will look at artworks and hopefully be able to use these as springboards for some time getting creative, and a lot of time debating those themes if that's the way the course takes us. So it should be really, really exciting, and fingers crossed there'll be plenty of time to explore the museum actually on site, I think.